During phase 3, the focus is on improving the function of the shoulder and muscles around the shoulder blade. The criteria to progress to phase 3 exercise include achieving full active range of motion or pain controlled within the available range of motion of the shoulder. You should have minimal pain and good technique with all exercises in phase 1 and 2. You should also be able to use your affected arm and shoulder in most, if not all, activities of daily living, including bathing, dressing, making meals, and putting away dishes. In phase 3, you can start by working on a lower number of repetitions and smaller ranges of motion and gradually increasing as your function improves. If you have pain with an exercise, adjust your posture or lower the repetitions and the weight you're using. When doing your resisted exercises, you should go to the onset of fatigue or discomfort, typically 2 to 3 sets of between 8 to 15 repetitions with 2 to 3 minutes in between sets. The goal is to progressively increase your tolerance and performance of these exercises over time. It takes consistency and time to improve your strength. Remember, we're aiming for between 3 to 6 months of shoulder rehab to achieve optimal outcomes. The goal of phase 3 is to progress from isometric exercises performed in phase 2 towards strengthening the shoulder through the available range of motion. One exercise to do this that's effective for strengthening the rotator cuff is doing internal and external rotation using a TheraBand. To perform this exercise, you'll want to use a towel. Remember your good posture. Have the towel tucked underneath the arm. This helps to keep the arm tucked in at the side and also helps the exercise to be more comfortable. From this position, you can grab onto your band, looking straight ahead with some tension on the band, pulling the band across your body. Hold for 3 to 5 seconds and return to the starting position for internal rotation. For strengthening, again, you'll want to repeat this exercise between 8 to 15 repetitions, aiming for about 3 sets, performing this exercise about once per day. The next exercise we'll go through is external rotation with the band. To perform this exercise, you'll want to have a towel tucked between your arm and the side of your body. You'll want to grip onto the band with some tension, look straight ahead, maintaining good posture. From here, you'll want to bring the band out to the side. Hold it for 3 to 5 seconds and return to your starting position. With this exercise, you're aiming for, again, between 8 to 15 repetitions, 3 sets, about once per day. While you're doing this exercise, you want to make sure that you're not twisting with your body or using your wrist to get the movement. You want to make sure the shoulder is doing the work. The next exercise in phase 3 that we'll go over is called side lying external rotation. To do this, you'll need a small weight of between 1 to 3 pounds. If you don't have a free weight at home, a soup can works really well and is usually around 1 to 2 pounds. You also need a small towel and a pillow. To do this, you'll want to tuck the towel between your arm and the side of your body. Lie down with your head supported on the pillow. It's really important that you don't strain your neck while you try to do this exercise. So you want to have good support. You may need 2 pillows to make sure that your head and neck are in alignment. You also want to make sure that you're not rotated too far forward or too far back, but you want your shoulders to be stacked on top of each other straight into the bed. From your starting position, with your weight just hanging at your side, resting in front of your belly button, you want to raise the weight while rotating your shoulder upward toward the ceiling. So slowly bring it up. Hold for 3 to 5 seconds at the top of your motion, and return slowly to your starting position with control. It's really important you don't just let the weight drop, but make sure that you have nice, smooth motion, controlled motion on your way back to your starting position. You're going to rest for a couple seconds and repeat the motion. While doing this movement, it's also important that you don't rotate your body at the top of the range. You want all of the movement to be happening through the shoulder. Up, hold for that 3 seconds, and back to the starting position. This exercise, we're trying to do between 8 to 15 repetitions and aiming for between 1 to 3 sets, once per day. Maintenance exercise is important to managing your pain and maintain your function. Consider your exercises like medicine for your shoulder. You may regress or get weaker if you stop exercising, and symptoms can come back. Also remember that the exercises covered in this video are provided in the handout on exercise-based shoulder rehabilitation given to you at your appointment. This concludes the video on exercise-based shoulder rehabilitation. Thank you for your attention.